Welcome back. Talking about mental health can be intimidating, and a lot of that has to do with many stigmas around it. And with mental health affecting so many Americans, it's really time to stop the negative talk about these, negative stigmas. And here to help, Dr. Krystin Holmes with the Harris Center for Mental Health. Good morning, doctor. Thank you for being here this morning. It's such an important conversation to have right off the bat. I mean, there are so many stigmas that are associated with mental health that they really shouldn't be.
Yeah, so some of the stigmas we see are that mental health is a sign of weakness. People are afraid of being judged or labeled if they acknowledge mental health or having any difficulty with mental health. There are also some cultural beliefs that can attribute to the negative stigma, and then fears of being judged or missed opportunities in the workplace.
So let's talk a little bit about some of that, because culturally, we live in a very international city area. Different cultures maybe react differently and treat their families differently, their kids differently.
Sure.
So how is that affecting the stigmas?
So one thing I like to do is really educate families about what does it mean to have a mental health issue, whether that's anxiety or depression. And oftentimes I talk about it like it's humidity. By looking outside, we may not be able to see the humidity, but if we step outside, we're going to feel it. And so sometimes that's what mental health is like. We don't always know it or can pinpoint it just by looking at somebody, but we know it when we see it and we can feel it. The other sign I think of is just trying to understand what our loved ones might be dealing with, understanding our cultural beliefs and where that comes from. And that some cultures, it is not popular to talk about mental health. We don't discuss it, we kind of shush it, don't tell family secrets. But when we hide mental health, it oftentimes gets worse and it perpetuates this negative stigma.
And I've found that even the younger generations, me growing up with different cultural differences, and now that I'm older, is like, it's okay, to my family, you can talk about this stuff, and kind of teaching the older generation to change their ways, in a sense. So do you find that as the younger generation is more open to getting treatment, to looking for help, maybe their parents, their grandparents are starting to change as well? Yeah,
so the positive news is that we are seeing, I think, a cultural shift as people are growing up, they're recognizing, hey, this is very real, and just because it's not a broken arm with a cast that I can't see doesn't mean it's not impacting my loved one's life. And so I'm excited that there is a positive shift to, hey, let's talk about it, let's come to therapy, that it's not, you're this horrible person if you talk to a therapist. Sometimes you just need that objective third party that's not within your family, that's not your neighbor, a minister, who are all wonderful people, but sometimes we need that licensed professional ear.
Therapy's great. Everyone should get some therapy, even just to check in, How do stigmas, doctor, impact those in need of these medical services? So, someone is really in need of seeing a doctor, but maybe they're in a situation where, whether it's a family or friend or loved one, telling them you don't need it.
Yeah, so sometimes what that does is it delays the care that somebody really needs. And so when they're afraid of seeking services, they might not tell anybody, they want to hide it, and that might make the symptoms worse before they get any better. One thing I encourage, we have really discreet ways now of reaching out for help. If you're a youngster, you can text, or if you're older millennial like myself, you can text too. We have 988, which is a crisis line, and the Harris Center has a 24/7 crisis line that you can call anytime, day or night. There's also the harriscenter.org and many resources that are discreet in nature, and there's even online services, so telehealth and therapy that you can get, and you never have to leave your home to go do it.
Yeah, it's super easy, super fast if you are in need of any of these services. What about communities? What about workplaces? How can they help to create a more supportive environment for those dealing with any kind of mental health needs?
So in the workplace, I advocate for a people first mentality. I assume that my employees really want to do a good job when they come to work. And if they're not, I'm going to ask, are you okay? What's going on? Is there something I should know about that I can help you with? And so I think educating our leaders and our managers about what it might look like if somebody is struggling with depression or anxiety, and how to ask just, hey, are you okay? And then further educating our workforce and our staff on, if you're experiencing these things, what can we do for you? We may have employee assistance programs, allowing flexible work hours so that someone may take that hour that they need to go to their therapy session, even virtually, and then be able to come back to work in a hopefully better headspace.
Yeah, and if families or folks that are watching and maybe going to share this with somebody, what are some symptoms that people really should look out for? Because it doesn't have to be such an extreme symptom. It could be something super small, of just kind of having a fear or a worry every now and then about things.
Yeah, so something common that I look at is when people have excessive worry over things that didn't used to bother them. Like driving downtown, am I worried about getting in a wreck? Well, I mean, honestly, yeah, probably. But if it's more so than I have been in the past month or 2 months or 3 months, I'm going to ask why. Also, isolating from things that we love to do, enjoyable activities. If we're finding ourselves closing off from our friends and loved ones more often, that would be a time to start reaching out for some help to figure out what's behind that. Why am I not engaging the way I used to?
Okay, Dr. Krystin Holmes, thank you so much from the Harris Center. Really quickly, where can they find more information and get the resources they need?
Sure, you can go to theharriscenter.org. We also have our crisis line, 713-970-7000, and you can also text 988.
All right, thank you, Doctor, so much for being here with us.